Nurse Paul, I'm concerned about Mr. George's recent echocardiogram. The ejection fraction has decreased significantly. We need to discuss a more aggressive treatment plan.
I understand Dr. Mihira. His symptoms have been worsening, and he's been experiencing more fatigue.
We should consider increasing his beta blocker dosage. It can help improve heart function and reduce symptoms.
I'll inform the patient and monitor his response to the increased dosage. Should we also adjust his diuretic?
Let's reassess his fluid status and adjust the diuretic accordingly. We want to manage his congestive heart failure symptoms while avoiding excessive fluid retention.
I'll also ensure he's adhering to his sodium-restricted diet and limiting fluid intake.
That's important. We should also discuss the possibility of a cardiac rehabilitation program. It can help improve his overall heart health and reduce symptoms.
I'll schedule a consultation with the cardiac rehabilitation team, Dr. Mihira. Mihira, I know that sharp, shooting pain from sciatica can feel overwhelming and frightening, but please be gentle with yourself right now. Your body is asking for a bit of extra care, and there are some simple, kind ways to help ease that intense discomfort in the coming days. When the pain is very acute, you might try soothing the area with cold packs wrapped in a cloth for about 15 minutes at a time, which can calm the angry inflammation around the nerve. A couple of days later, switching to a warm pack or a warm bath can help relax those tight, spasming muscles that are adding to your pain. You can also consider over-the-counter anti-inflammatory medicine, but do check with a pharmacist to make sure it's safe for you. As for movement, the most compassionate thing you can do is keep moving gently, but avoid the two extremes of complete bed rest or pushing through the pain. Try not to sit or stand for long periods. Your back will likely feel better if you change positions frequently. When you must sit, a small cushion behind your lower back can be a great comfort. Very gentle, non-painful stretches, like lying on your back and softly pulling your knee towards your chest, can help soothe the nerve. Finally, always remember to protect your back by bending your knees and keeping the load close to your body when lifting anything, rather than bending at your waist. This will pass, Mihira, and each small, mindful choice is an act of self-compassion.